So one client that I'm currently treating right now with my educator, he has paraplegia, and that resulted from a surgery where they were trying to remove a tumor from his cervical spine. So he currently is in a motorized wheelchair, and that's kind of how he gets around. I'm just going to say a little bit more about him here real quick before I go into some of the other stuff. So he requires mod assist to complete sit to stand and moderate assistance to maintain static standing. He reports that his surgery was performed last April, after which he had two separate stints of inpatient rehab. In between the two phases of rehab, he reported that he was unable to use his left arm due to decreased function and control as well as increased pain with his wheelchair function. He requires mid assist for squat to pivot to the left and to the right. He also requires moderate assistance to complete sit to stands and mod A to maintain the static balance, which is what we're working on right now with him. He also demonstrates decreased motor planning and control of bilateral upper extremities, trunk and bilateral lower extremities, with his left side more affected than the right side. And he also reports difficulty completing all ADLs and those IADLs, the dynamic sitting balance, transfers, and self-catheterization. So those are some things that were just in his occupational profile and some things that he said he was going to want to work on. So an assessment that you could use would be the COPM. So one thing that I really like about the COPM is it measures their self-care, productivity, and leisure, but it's so client-centered. It's based on like the satisfactory of the client. So from doing that, you could learn, for example, he has been into inpatient 2 times, and so he has a caregiver full time, and he is satisfied with her helping him do all of his dressing. So he's satisfied with it, so he doesn't really want to work on it in outpatient with us. What he was unsatisfied with was his transfers. So that's something that we could find out through the COPM. The next thing is the range of motion and manual muscle testing. We did that to see where his limits were and to maybe increase those. The 9-hole peg was also used for the beginning sessions because it measures the upper extremity function and dexterity, and it really gave us a picture of, oh, his left side is definitely a lot weaker, and the dexterity is significantly decreased compared to his right side, which still ended up being impaired. Like I said, with the dressing techniques, you can do a lot of adaptive equipment, but because he's satisfied with that and his caretaker puts on his pants and his shirt for him, that's just not something that he thought would be beneficial to work on. With him, he wears loose fitting clothes. He only comes in with sweatpants. It would be important for this client to make sure that because he does have a side that is significantly more impaired than the other, that he starts with that side. So if he were to put on his shirt, he would put it on with that side that's the weakest. Another thing that we've been working on with him is body momentum and being able to use your body in your force as much as you can, because although there are a lot of impairments, there are a lot of things that he knows he still can do. And it helps too that he is an athletic trainer, so you can kind of talk to him in like the medical terms and he really understands that and appreciates that, because then it makes it personable. For our transfers, we do wheelchair to seated, and then we do sideline. Okay, so here what my educator and I are doing are sit to stand transfer with the two-wheeled walker. And so we have her use her momentum and come up. We're both holding her knees and making sure that it's locked.
A little closer, go for it.
And then I quickly take my side of the walker and bring it towards the patient. And the patient can help a little bit to bring it forward. And then we make sure that our foot is in the front of that four-wheeled walker wheel.
Do a little bit straighten or?
Yeah.
Go for it.
And then we also decided to start working his muscles a little bit. So then we have him do some knee flexion and extension.
You are. No, you're
just going from right to left, and then we have him sit down, and we'll do that around 3 times.
Good. Okay.
So that's our sits to stand. Behind the sideline and then sideline to sitting, and right here it's important to put your hands by her hip and her shoulder, and then we're going to count over, bring over on 3. Then with the